Christina Aguilera has dazzled audiences with her powerhouse vocals and captivating performances. Alongside her musical evolution, there has been ongoing speculation about changes in her appearance, prompting questions about the role of plastic surgery. Let's look at Christina Aguilera's facial transformation over the years. Estimated costs of potential procedures are provided at the end of the video. In 1999, at the age of 19, what we're seeing here is that Christina has a relatively short forehead. When you look at the upper third of her face compared to the middle third and lower third, the upper third seems to be the shortest third of her face. She also has a very symmetrical upper third. When you look at the eyebrows, the supratarsal show, and the leveling of her eyes, it looks like they're very much on the same level. This isn't the case for many people. She also has full, youthful cheeks and a thin upper lip with a short philtrum and gum show on smile. In 2000, at the age of 20, what we're seeing here is a strong chin and jawline. And this is a characteristic that we see in many celebrities and models, men and women, that we analyze on this channel. This feature is actually protective when it comes to facial aging because it limits the amount of neck laxity that we see in people over time. When the chin is weaker, the jowls and the rest of the lower face start to descend at a faster rate, and it becomes more obvious that there's facial aging occurring. When the chin is stronger, we see that oftentimes things look tighter and more lifted for a longer period of time. In 2001, at the age of 21, I see no change. And in 2002, at the age of 22, there appears to be some enhancement to Christina's eyelashes. Now, there are different ways to enhance the eyelashes. One is, of course, makeup, such as mascara, that can make the eyelashes look more prominent. Also, some people use false lashes, and that can, of course, make it look like you have fuller lashes. Some people are big proponents of brushing the lashes and also massages around the lashes to help them grow fuller, while others use topical medications such as Latisse or bimatoprost. This has been shown to increase the anagen phase of the hair growth cycle. There are also serums out there, such as natural oils and peptides, that can in some cases help the lashes grow more. And there is such a thing as eyelash hair transplants, but they're a bit tricky because sometimes when the hair grows out, it actually faces the cornea of the eye, and that can lead to various problems such as corneal abrasions. So we tend to avoid eyelash hair transplants unless it's being done for like cancer patients or burn patients, for example. And I'm noticing here that Christina is starting to overline her upper lip, and some refer to this as a lip lift that can just be done with makeup. But keep in mind there's also a surgical lip lift that we talk a lot about on this channel, and we have a recent video dedicated to lip enhancement options, both surgical and non-surgical, so make sure to check that one out. In 2003, at the age of 23, what I'm seeing here is that Christina has thinner eyebrows, and this can be just from plucking the eyebrows, but keep in mind that over plucking of the eyebrows can lead to more permanent alopecia of the brows. Some people thin out their eyebrows to give the illusion of higher set brows. But remember that if you continue to pluck or get threading done, for example, that can ultimately lead to a thinning that basically is permanently that way unless you cover it up in some fashion, such as with makeup, tattooing, or an eyebrow hair transplant. So be careful with what you do in your 20s because that can have ramifications into your later years, and you might regret some of those early aesthetic decisions. In 2004, at the age of 24, I see no change. In 2005, at the age of 25, it looks like Christina may have had veneers around this time. It seems like her central incisor gap is now closed and her teeth appear more symmetrical. And in 2006, at the age of 26, I do see some signs of a potential upper blepharoplasty or upper eyelid surgery. There is now increased supratarsal show and a bit more hollowing to the upper eyelid region. And this to me appears sustained in more recent photos as well. The irony with upper blepharoplasty is that people get this procedure to look more awake and for their eyes to be more open. But sometimes when an upper blepharoplasty is, say, overdone, it can lead to more hollowing of the upper eyelid, giving the face a more aged type of appearance. In 2007, at the age of 27, I see no change. In 2008, at the age of 28, it looks to me like Christina has her natural nose. There's a small dorsal hump and there's nasal projection that's balanced against her strong chin. If her chin were weaker, it would look like the nose was potentially overprojected, but because of the chin having good strength to it and good projection, now there's balance between the nasal projection, the positioning of her lips, especially her bottom lip, which is a bit more protruded than the upper lip, and then how that falls with the chin. When you draw a line along those features, it all works together quite nicely. In 2009, at the age of 29, I see no change. In 2010, at the age of 30, it looks to me like Christina may have started to get Botox around this time, and to the usual locations, such as the forehead, the glabella, and the crow's feet. Because by 30, I would expect her to have at least some degree of early static lines, and especially she should have some dynamic lines on the forehead when animating. And I just don't see any signs of that. So that to me suggests that she's already starting to get a neurotoxin injected into those areas. And more recently, as Christina has started to endorse Xeomin, which is a neuromodulator, she has started to be a bit more open about getting these types of injections, though that relationship is much more recent. I think the early signs of neuromodulator dates back to around this time in 2010. And in 2011, at the age of 31, there appears to be more facial fullness. This could be because of just general weight gain, but it could also be because of filler to the lips, the cheeks, and the under eye area. You can see that her lip shape has started to change. There's now more arching. The Cupid's bow and the philtral columns appear more defined. And to me, it appears that it's most likely the effect of filler rather than, say, a surgical lip lift, because the philtrum itself does not look to be any shorter. In 2012, at the age of 32, I see no change, and that's the same through 2016. In 2017, at the age of 37, I do see some signs of lip filler migration. So getting any kind of lip filler puts you at risk of having this type of migration. There are some ways, however, that you can at least attempt to prevent it. One way is to use smaller quantities. A lot of people will buy a syringe of filler and they expect that that syringe should be fully injected into their lips. But when that happens, oftentimes there's too much filler, and then that filler will eventually spill out of the pink part of the lips into, say, the cutaneous portion of the lips, and that's unfavorable. So it's better to start with smaller quantities and to do the injections less frequently. So not coming back every 2 to 3 months for your lip filler, but spacing it out as much as possible to limit the overall quantity of filler that's placed into the lips. Another way to reduce the migration of lip filler out of the pink or red lips is to not inject the vermilion border. Oftentimes it's a tempting place to inject because people are trying to recreate that natural roll that exists between the cutaneous lip and the red lip. But instead, if you avoid the vermilion border injections, you're less likely to get a spill out into the cutaneous lip. And with the continued use of facial filler, we sometimes see, like in Christina's case, a blunting of the nasolabial folds and the lid cheek junction. As you start to erase the natural boundaries of the face, things can start to look a bit more artificial. So it's normal to have a nasolabial fold that will separate the perioral area from the cheek complex, and to have some degree of a transition of a lid cheek junction here between the actual periorbital area and the cheek area. And when you efface all that with just dumping lots and lots of filler into the area, it starts to look like it's just like one thing, and that doesn't look totally natural. In 2018, at the age of 38, Christina is starting to have fuller eyebrows. And this could be because she just stopped plucking the eyebrows, so they are starting to grow in and appear fuller. It could also be because of the use of makeup. And some people end up getting a tattoo for the eyebrows, so it at least always holds a certain shape. Other people try something like microblading, which is also a form of a tattoo, but it's placed as like these streaks along the eyebrows to give it a more natural appearance. And yet other people choose to get an eyebrow hair transplant, where hair is taken from the back of the head and brought into the eyebrow area to actually bring a fresh supply of hair into the region. We have an entire video devoted to eyebrow hair transplants, so make sure to check that one out. Now in 2019, at the age of 39, I wanted to compare back to 2009, so 10 years prior, and let's see what some of these differences are. When I look at the upper third of the face, it still looks like Christina's original face. But when we start to look at the middle third and the lower third of the face, they appear much fuller than they did before. And we talked about the use of filler into the mid-face, but filler can also be used into the lower face to try to mask the appearance of jowling. So sometimes if it's overused, it can look like the lower face is starting to protrude a bit, almost like you have like a chin implant or like a jaw implant if it's placed along the bone of the jaw. Now, while it can be helpful for reducing that appearance of some degree of sag, it can also start to migrate as well, just like lip filler can. And as the lower face and the mid face get fuller, it again blends together and gives you a much fuller facial appearance that some people refer to as filler fatigue. And it's unclear if these effects were the result of HA filler being used or something like a fat transfer. Fat transfer, remember, is still another form of filler, but it's your own fat that's harvested, usually from the abdominal area, processed, and then injected into the face. About 50% of that fat won't survive. And while the fat transfer can lead to a more long-lasting result as far as the added fullness, it might also give you some effects that are difficult to reverse. So you could get little clumpy areas, and you can't reverse. There's no reversing agent for it. So you'd have to go in and actually remove surgically those little areas that might appear lumpy bumpy. Also, sometimes people get additional treatments of fat transfer to bring some additional volume into the face. So one round of fat transfer usually is not enough to sustain you for your entire life. And in 2020, at the age of 40, I wanted to point out here how important skincare is, because Christina's skin is always so vibrant. First and foremost, sunscreen is extremely important in protecting us against the sun, and not just preventing skin cancer, but also to prevent aging effects of our skin that are caused by the sun's UV rays. In addition to proper sunscreen or sunblock use, cleansing your face and moisturizing your face is also very important to giving you that pillowy, youthful look. And there are several high-quality skincare products available at feelconfident.com to leave your skin looking like the amazing skin that we see on many of the celebrities that we analyze on this channel. In 2021, at the age of 41, I see no change. In 2022, at the age of 42, I'm seeing some signs of a potential facelift, specifically with an endoscopic approach. And the reason I say that is because the tragus appears unchanged. You guys know that I'm always harping on the appearance of the tragus and how it changes with many facelift types. But with an endoscopic approach, when you're going more from a behind the hairline type of incision and you're dissecting from up there and getting into the deep plane, you'll oftentimes not affect any tragal change because you don't need to make this incision in front of the ear or behind the ear. When that incisional approach is spared, then there's no reason why the tragus needs to change. Other than the jaw tightening, another reason why I feel that maybe Christina had a facelift around this time is because of the increased space or the distance from the lateral brow to the hairline edge. When you look back at her photo from age 19, you can see how close those two areas are, the temporal area of the hair to the actual lateral eyebrow. As an endoscopic brow lift is performed, oftentimes that hairline goes back and that eyebrow doesn't necessarily move as much. So you have a tail of the eyebrow that's fairly fixed, and then you have this hairline that's pushing back, and that opens up this distance and can be a giveaway sign of an endoscopic facelift approach. Also, the lateral canthus of Christina's eye appears to be pulled higher, and that can also happen with an endoscopic facelift. This endoscopic approach is becoming much more favored for younger patients who don't have a ton of skin laxity. As we age and the skin starts to drop down and the tissues start to develop more laxity, in order to reposition those tissues, you do need to make an incision at least in front of the ear and sometimes behind the ear to resolve that excess skin. Because when you go to lift, you'll have a bunching of skin. So in order to remove that bunching, that's where those incisions come in. But in younger patients where it's not so much that they have a lot of loose skin, making an incision up here behind the hairline is usually possible. In 2023, at the age of 43, I see no change. In 2024, I'm seeing the reversal of some of that facial filler. This could be from the use of, say, hyaluronidase that we know breaks down hyaluronic acid-based fillers. When trying to globally dissolve hyaluronic acid filler, I like to use a cannula approach. I do that in the lips, and I do that if I need to anywhere else on the face. And I dilute the Hylenex significantly to reduce the burn that some people feel, and also because hyaluronidase can at times thin out your natural tissue. So using it at lower concentrations and diluting it with like sterile saline is really beneficial for dispersing that hyaluronidase and doing it in a safe and effective way. In looking at some of Christina's recent photos, I'm noticing that she has overall lost weight, not just in her face, but in her body as well. And one thing that came to mind was Ozempic, since many people have been on Ozempic, celebrities and otherwise. And we have a full video on Ozempic, what it is, how it works, and specifically we discuss Ozempic face in that video, so make sure to check it out. In Christina's case, you can see the effects of Ozempic face. You can see it in her temples, you can see it in the orbits and in the cheeks. Everything just looks much thinner, and there's a loss of that natural fat, and potentially also she may have had that hyaluronidase placed to dissolve some of the old filler. So those two in combination create a very significant effect on the overall appearance of Christina's face. So now when we compare back to Christina in her 20s, what we see is that the upper face and the mid face are quite similar, but the lower face looks very different. And I believe that's primarily because of the lip area. There's been a huge change from her original lips to how her lips look now. And I think that's mostly the effects of lip filler and also the way that she overlines her upper lip. Keep in mind that even after you've dissolved lip filler, sometimes the lips still maintain a fuller appearance. It's like if you took a balloon and filled it up with water and then you take that water out. Usually the balloon is going to be larger than when you started before you even placed the water in. So too, the lips are very delicate and behave in a similar fashion. So even if the lip filler was completely dissolved, it's still possible that Christina was left with a fuller appearance to her lips. And the total cost of these potential procedures is $285,000. In Christina's words, "I am beautiful no matter what they say. Words can't bring me down. I am beautiful in every single way." This is something that we should always remind ourselves of. You can look and feel beautiful with or without plastic surgery. And that's the creed that we live by at Feel Confident as well.